Hey gang, what's going on? YouTube world. Wanted to just touch base with you guys. I miss you guys. It's been a long time since I've touched base and found out what's going on with YouTube world. Been sort of shut in past couple of days. Weather has not been nice here in Northwest Arkansas. It's currently -1 outside. I've moved the operation from the home office in Bentonville to the the actual home office, not the office, just because it's sort of not the best conditions for driving right now. So I figured I'd just hunker down and keep it shut in. And believe me, I'm already feeling the effects. So, with that being said, me feeling the effects, I wanted to sort of catapult off of that notion, talk about mental health, which, as you guys know, I take a great deal of joy in talking about. So, really through the lens of PTSD, because that being a qualifying diagnosis in Arkansas where I practice, things that can trigger PTSD become part and parcel, a routine part of my practice. Awesome. Boom. Gonga, welcome. So good deal. So yeah, the idea of managing PTSD, especially through the guise of when we're shut in, folks. I like to focus on the mental health a whole lot, the management of the anxiety component of the PTSD, the fight or flight response. If we have an aversive memory, as well as the depression portion of it, because oftentimes there's a lot of self-directed guilt surrounding events. What did I do to deserve being treated wrongly? Or what did I do to deserve the chain reaction of events that ultimately culminated in me being on the receiving end of trauma? So there's oftentimes a lot of guilt associated with that, as if the person might have done something themselves to deserve it. Okay. So I like to address this, guys, because things become a little tougher to manage come the winter months. There's definitely some sort of linear correlation between the lack of sunlight or the shortening of the days of which we have access to any sort of daylight, be it direct sunlight or not a whole lot of direct sunlight now, but the incidence of shortened days and worsening of mental health, right? I definitely see it in the clinic. I've always sort of seen this, and I'm not the only one practitioner who can speak of this. Henceforth, seasonal affective disorder, usually in the colder winter months. So, it's important that we get into this, folks. Dosing comes into play. Reason why dosing comes into play, because people are going to turn to whatever adaptive techniques that they have in hand when they're faced with possible triggers. When we're shut inside, our minds tend to wander because we don't have as much outlet for physical movement. When our physical area is shut inside, our mental space is also restricted. So if we find ourselves ruminating on an uncomfortable thought or an unsavory event or any sort of aversive memory, we can get stuck on that for a while, right? And that's the thing that I'm looking to circumvent. And what happens when we get stuck on those things for too long, we can lean on a maladaptive coping mechanism and medicate with cannabis when we should possibly be doing something else. Now, word of caution, word of note, I want everyone to be able to observe proper medication guidelines. Once again, guys, 5 milligrams THC. I like to put this out so patients know, more so, or at least equivalently so practitioners can know. 5 milligrams THC is the standard accepted dose if we're talking about the inhaled route. And for the most part, the sublingual route, 5 milligrams THC, 5 to 10 milligrams if we're talking the sublingual route, because of slightly different absorption in that sublingual capillary bed versus the inhaled bronchial bed where we're getting perfusion in the lung. Okay, so 5 milligrams THC per sitting is what we're looking at if we're talking about whole leaf full spectrum preparations. All right, if you're taking something that's more of a concentrate, you might require more than 5 milligrams of THC, because without the entourage effect of the accessory cannabinoids, you're going to require a higher amount of THC to get the same level effect. Let me just review that one more time so it's more clear. Say you're using a vapor pen, right? One of these pre-filled pens with the liquid oil vapor that you turn on, it heats up, and then you take a hit of it. Typically, these are higher THC, 80% and above, up to 90+% THC, very concentrated. When they go through the process of isolating this product, they strip away a lot of the CBD and a lot of the CBG and other accessory cannabinoids and flavonoids. So it's basically only THC that you have and not much else. So consequently, you're going to have to use a higher dose of that versus something that's swimming in a sea of the other entourage compounds, CBD, CBG, what have you, the host cannabichromene. There's a host of other ones in their native acid forms before they're decarboxylated and combusted. When you have that whole leaf preparation with the full spectrum, you're able to release all of these things all simultaneously and get an equivalent euphoric effect or medicative effect at a lower THC concentration. So 5 milligrams of THC, a full spectrum whole leaf product, will be as effective as a higher, say 10 milligrams of a concentrated oil vape product. Okay, so almost the same rationale will go when you're talking about edibles, talking about dosage. 10 milligrams edibles standard dose, 10 milligrams THC when taken the oral route, chewed into the stomach, then acted on by the liver through first pass metabolism, and then released into the bloodstream. 10 milligrams THC, okay, about 90 minutes until activation time when you're talking about the oral route, 1 to 5 minutes when you're talking inhalational route, which is either through combustion, the smoking, my least favorite, dry herb vaporizing, which, as you guys know, I talk about it a lot with my patients. I'm a big fan. The dry herb vaporizing, I'll get to that more. But I wanted to touch on the dosing. Important, we talk about the numbers and amounts so that people understand, even if they don't measure out 5 milligrams THC, that works out to say 2-3 inhalations versus 15. Okay, that's the important thing that I want people to realize. You know, dosing, it's always less is more, so that we can keep our endocannabinoid system primed and sensitive to external cannabinoids. All right, that's the reason why I talk about dosing. It's the reason why I'm talking about things like seasonal affective disorder, PTSD, control of mood, that sort of thing in winter, because we're stuck inside now. And I want to talk about this in real time, because a lot of people, a lot of my patients, a lot of people who aren't my patients who might be watching, who I still want to reach out to, they're juggling a lot of things. Chronic pain patients, they're not able to walk around and get around as much. The possibility and threat of injury is also higher when we're talking about wet snow, ice that tends to be very slick. There's a lot of different things that come into play. You know, people have to still act with caution when using marijuana products, walking outside. If you're an elderly person and maybe your balance isn't that great, marijuana doesn't give you better balance. Though some might think so if they put on the right music, think something hits them, they bust a move. But just safety concerns to keep in mind, especially when people have had previous injuries and there's some degree of, you know, things like sciatica where someone might favor one hip or another, or if someone has a leg length discrepancy where one leg is longer than another, things like that. And dosing, use of marijuana, anything that has a psychotropic effect, definitely something to keep in mind. We're talking about ice, we're talking about injury, things of that sort. Okay. So getting back to the mood issue here, guys, PTSD and post-traumatic growth. I wanted to touch on it, really just because, there's good, there's there's good info out there. I came across one in Scientific American, this article from Mr. Kaufman, Scott Barry Kaufman, April 20th, 2020, post-traumatic growth, finding meaning and creativity in adversity. And I think this is important to touch into, because people early on in PTSD, people go through a cycle of growth when you go through PTSD. Like a lot of things involving mental health, these things go through phases. And post-traumatic growth is basically being able to use an adverse event and spin it on its head and use it as a tool, as a catalyst for growth and creativity, and to be able to use it to build resilience. And I know that sort of sounds counterintuitive, to go through something awful, then use it to your benefit. But really, when you're faced with PTSD and feeling like you have lack of control over your emotions, some people will liken it to floating, sort of falling and not having a parachute and just being victim of gravity. If you're falling in the air and all you're doing is falling, and you have no parachute, you really have no recourse. You can't call a friend. You can't do anything. You're going to continue to fall. And that's just the feeling ultimately. Well, ultimately. But, it is what it is. But, when it's a very disconcerting feeling of helplessness, and getting people to a point where they no longer feel helpless is sort of the aim. Okay. And the reason why I bring this up as a subject, post-traumatic growth being an entity in and of itself, I like to bring it up because it gives people hope to think that there is a more light at the end of the tunnel. And I think employing something like cannabis that can equip someone with a higher degree of quiet insight, okay? Having the advantage of stepwise quieting the mind to be able to contemplate events and make sense of them. And that's what I'm talking about when I'm talking about growth. True growth is a process that happens over time, okay? It takes us years to grow up and mature enough to leave the house. 18 years. Okay. So for some folks, different. All right. But it takes us a long time to grow and mature. And really, from an emotional standpoint, our emotions don't really mature, right? We're childlike in our emotions, how we feel, what makes us cry. Things that made us cry as children will likely still make us cry now. Okay, or at least make us feel to. Laughter, the feeling of wanting to be loved, all of those very basic yearning feelings, those don't mature. We mature in our capacity for executive function and being able to adult and pay our bills and adapt to those sorts of day-to-day changes that require the calculus of adult life. Sure. So we mature in that, and being able to modulate our emotions so we don't exhibit them in inappropriate circumstances. But that comes at a cost, because we're trying to modulate something that's natural and comes to us as second nature, as breathing. So that's the cost that we take in tamping the volume of that natural emotional reaction down. Okay. So at some point we have to acknowledge that. And I think using something that can quiet the mind to access that very primal, that very raw and vulnerable part of ourselves. Okay, it's not all the time that we're able to access a part of ourselves that's really a true, raw, and emotional, and unique just only to ourselves and only to our personal history. When we take the time to acknowledge it and take a good look at it, we can separate the wheat from the chaff, and we'll find a lot that stuff that we beat ourselves up over is stuff that was just happened to us and might have been the work of someone else. And oftentimes the little stuff that we might have screwed up, we've moved on from already. We've already, and the little things that we have to do next is really just a short list of things that we have to do next. And usually those things we can acknowledge when we're able to have a clear path of insight to our inner selves, and cannabis does that very, very well. So I wanted to touch on the possibility of post-traumatic growth and just urge folks to, really be patient with yourselves in your quest to move forward past mental anguish, because each day is just one little step forward. And don't get yourself beat up because the weather sucks, because we have no control over it. Believe me, I can feel people beating themselves up over it. I'm beating myself up over it, and I know I have no control over it. So find a good spot, folks. Coping mechanisms become crucial in times like this. When we think we might need to medicate, we might be really yearning for something else, which is that social connection. So don't neglect that. There might be a good friend, a good family member, someone trusted. Call them up. We do have the advantage of technology where we can use it to our advantage and video call. Getting that close connection and feeling something familiar can be crucial at a time like this. So as much as you might want to familiarize yourself with a little doobage, take the time to maybe reach out and reconnect with someone, or something. If you're unable to do that, try and reconnect yourself with something, a good piece of music or a piece of art or an activity that maybe you put down before. Now with some extra time inside, we might have a little time for a little mental or emotional house cleaning. And if you don't have time for mental or emotional house cleaning, you're stuck inside. Clean up your house. Clean up. If you must do the dab rig, maybe now is a good time to clean up the dab rig. So think about that, folks. Don't mistake this time for just letting it pass and let nothing happen. We can make progress really at any time, and sometimes a day inside is a good hidden opportunity to focus on something that maybe we hadn't had a little bit of chance to focus on. And oftentimes that can mean a piece of our inner history that maybe we've been shoving to the side because we thought we couldn't progress and have post-traumatic growth. Well, guys, this is a possibility that we can get through little by little. I have faith in you. Aim for this, cannabis or not, right? And cannabis, as I said before, is just a great catalyst to open the mind to the extra degree of horizon and pull the camera back so you can see a little bit wider, slow things down and sort of pan back and come up so we can see things a little bit wider. Cannabis is great for that. But even in the absence of that, just taking the time organically to stop and take a good look at things, I think the payoff could be huge, just if we're able to disconnect ourselves a little bit better and just take a little bit of inside inventory. So I'd like to invite yourself, everyone out there, if you've been affected by something that's tattooed the mind and you found it just tough to get a little bit of movement past it, and you find that it's affecting either your day-to-day or something like a consistent day-to-day, or occasionally throughout the week, causing trouble in your day-to-day functioning, social relationships, casual relationships, close relationships, ability to trust, ability to communicate well, ability to sleep, feeling like people have emotional control over you because you have a history of someone having emotional control over you. These are things that, we can pick apart piece by piece and get progress every day, even if we don't solve it all at once. Okay. Solving things all at once. Sometimes solving things is not an option, but getting progress is an option. So I'd like you guys to think about that and don't get stuck too much in the day-to-day. Trudge on. Dr. Dan, Air MMJ Cards, if you guys are curious to know more about cannabis or the process of certification, especially here in the state of Arkansas where I practice, feel free to hit me up, drop me a line, at armmjcards.com. Nice talking to you guys. I've missed you guys. Hit me up with questions. Nice talk.